Root canal therapy is a common dental procedure that is commonly misunderstood or shunned by a lot of. It is, however, an essential procedure that can protect your teeth and ease discomfort and pain. In this clip, we'll explore how the root canal procedure works through the steps and how it's important to protect the oral health. Step 1. Diagnosis. The very first stage of the treatment of a root canal is to determine the cause. When a tooth is badly affected or has decay, this can result in intense pain and sensitivities. The dentist can conduct an exhaustive inspection of your tooth and might take x-rays to evaluate the severity of the injury. If the pulp in the tooth is infected or injured and inflamed, a root canal procedure might be needed to save the tooth. Step 2. Anesthesia. After the diagnosis has been confirmed, after confirming the diagnosis, the next step will be to treat the area surrounding the tooth by using local anesthesia. This ensures that there is not any discomfort or pain throughout the procedure. Most patients worry about surgery to treat their root canals because they believe it'll be painful. However, using modern methods of anesthesia, it is practically effortless. Step 3. Accessing the pulp. After the region is an area that is numb, the dentist will cut a small space in the tooth that allows you in order to allow access into the pulp chamber. The pulp is a dental soft tissue. It includes blood vessels, nerves, and connective tissue. When the pulp becomes affected by inflammation or infection, then it should be eliminated in order to protect the tooth. Step 4. Cleaning and shaping. When you reach your pulp chamber, the dentist will employ special instruments to cleanse the affected or inflammation pulp. The dental canals are then cleaned and formed in order to get rid of any bacteria and dirt. This procedure is vital for ensuring that the infection is removed and the tooth is able to be saved. Step 5. Filling the canals. When the canals are cleansed and cut, they'll fill with a soft substance known as gutta percha. This substance seals the canals and prevents bacteria from returning to the tooth. The tooth then gets filled with a temporary seal in order to keep it safe until a permanent crown will be put in. Step 6. Restoration. The final stage of the treatment of the root canal is restoring the tooth. In accordance with the extent of the injury and the severity of the damage, your dentist could prescribe a crown or filling or any other type of restoration for the teeth to help strengthen it as well as protect it from harm. You must follow your doctor's recommendations on post-treatment procedures in order to maximize the effectiveness of the root canal therapy. Root canal therapy is a very effective procedure that could keep your tooth healthy and avoid the need to extract it. If you're suffering from severe discomfort or tooth sensitivity, take the time to consult your dentist for an examination. A root canal procedure may help relieve discomfort and preserve your tooth. Keep in mind that prompt intervention is essential to safeguarding the health of your mouth and to avoid any more costly treatment to come in the near future. The bottom line is that root canal treatments are an effective and important treatment for preserving the tooth and easing the pain. When you understand the process step by step of root canal therapy and undergoing the procedure, you will feel more secure and educated regarding the procedure. If you have any queries or questions concerning root canal therapy, be sure to talk with your dentist. Be aware that maintaining the health of your teeth is crucial to maintain your general well-being and health.